You now have 30 seconds to look at the notes.
So, Ms. Wayne, as this is your first appointment with me, I'd like to ask you a few questions and get to know a little bit about your medical history. It's also a chance for you to ask me any questions you might have.
Sure.
I understand from your GP that you have arthritis.
That's right, yes. It's in my hands and wrists mainly. The finger joints in my hands get really puffed up when they're swollen, like they are now. The pain can get so bad that it stops me doing a lot of very simple things. Things like having a shower or getting dressed. Then there's the trouble I have making breakfast. Anything where I have to grip and move my wrist, like holding the kettle and pouring, or buttering some toast. Well, you get the idea. It's not like I'm an old woman. I'm only 40.
I see. Tell me about your work.
I used to be a hairdresser, but I had to give it up after my hands started getting really bad. I couldn't just sit around the house and do nothing, though. So now I go to the local primary school where my kids are and help the children with their reading. And just lately, I've started helping out on the telephone helpline for people with disabilities. They have these special hands-free phones, so it means I can do the work without needing to use my hands so much. It's only a volunteer position, but I really feel like I'm doing something worthwhile.
Is your mobility affected at all by the arthritis?
I do have trouble getting in and out of bed or out of a bath. I also need help getting out of a chair if it's a bit low. I move around the house with the walking aid I have, and when I go out, I tend to use a wheelchair. Our car has also been modified, so at least I'm independent. I can go to the shops or out with friends.
I'm guessing you've had physiotherapy treatment before.
Yes. In the past, it's mainly consisted of heat treatment, but now I'm really interested in some sort of gentle exercises, if that's at all possible. I also really want to make sure that my hand splints are still helping and not making the condition worse.
Sure, I can look at that for you.
I've also been to an occupational therapist before. I needed help when things started getting really difficult around the house. I found her very helpful. She had lots of gadgets to help me do things like dressing and cooking, and so many good ideas about how to help with my tiredness without making the pain worse.
Okay, we can talk more about some of the techniques you use to help you at our next appointment. What about your medication?
I take analgesics for the pain mainly these days. I used to take those, those anti-inflammatory drugs, but the benefits seemed to wear off and they started making me feel sick, so I had to stop taking them. I do sometimes get a steroid injection, but not very often. It works really well at reducing the pain for a few weeks, but it hurts like hell. Dr. Wong has mentioned a steroid tablet I could take, which will work in a similar way, so we might be looking into that soon. And a couple of times a day I have an analgesic cream that I rub into my hands. I don't know if it really works very well though.
A doctor talking to Mr. Roy Daphnis about his planned hospital admission. You now have 30 seconds to look at the notes.
So, Mr. Daphnis, this appointment is a chance for us to talk a little about your upcoming surgery and for you to ask me any questions you might have.
Okay, yes. Well, I don't really have any questions about the surgery itself. I feel I understand the procedure quite well from all of my reading, but I do have a concern. I'm actually quite worried about how I'll go with my eczema when I come into hospital. It's important for me to follow my usual routine, you see, or it will flare up again.
What is it specifically that you're worried about?
Well, I've had eczema for years now, since I was a kid. It's chronic, I guess you could say, and there are all sorts of things that make it worse. Like getting too hot, like I'm in a room and the sun is shining in through the window and it starts getting very stuffy or something.
Okay, we can make sure that you have a bed well away from any windows if that'll help.
Yes, that would be good. Thank you. As long as I'm in an air-conditioned room and it isn't too hot, that usually helps. I also notice that certain foods and drinks make it worse. I stopped drinking alcohol years ago because it always made the itching worse. But I also have a list of foods that seem to aggravate things. So I was wondering if it's possible to give that to someone, or if I can let the hospital know so that they don't include any of these foods in my meals.
If you contact the hospital directly, they'll be able to help you with that.
Great.
Tell me, Mr. Daphnis, what's your skin like at the moment?
Not very good. You can see by my face how red it is, and the itching and scratching has been much worse lately. I think because of the stress I'm feeling about the operation. It's also really bad on my back and my legs. When I lie down in bed at night sometimes I can hardly stand it.
Do you ever get any sores or weeping?
No, my skin is just dry and very itchy. But I'm most worried that because of the operation, any broken areas in the skin will mean I'm at risk of an infection. I'm doing everything I can to prepare properly though. Instead of showers, I've been taking lukewarm baths. And I never use any soap because it leaves my skin extra dry. I know using it removes the natural oil, so I use a soap substitute instead. I'm being really careful about the clothes I wear to be sure that they aren't going to exacerbate the itching. I really don't want to be scratching it at all if I can help it, and I've been using an oily moisturiser nearly every hour. I don't like to use a lot of those steroid creams and things, but I can if you think it'll help. I see a dermatologist sometimes and he said if I don't like using them, I can save them as a last resort.
Okay, it sounds like you're doing everything you can to manage the condition, but you do need to try and relax and make sure you're getting plenty of rest. I know that stress is only going to make the condition worse.
You're right. I know I'm probably getting worked up over nothing, and everything will be fine. I'm taking an antihistamine at the moment, so that's helped with the scratching and I'm sleeping a bit better as well.
You hear a physician talking to a group of